Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. In this installment, we will be concluding our segment on insomnia with going over the diagnosis and treatment of insomnia. Before we begin, let me just remind you to please watch the full video because in the video there'll be three keywords. When I get to the keyword, I will say keyword and then what the keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, please put in the three keywords to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. Excuse me. Well, depending on your situation, the diagnosis of insomnia and the search for its cause may include a physical exam, which when the cause of insomnia is unknown, your doctor may do a physical exam to look for signs or medical problems that may be related to insomnia. Occasionally, a blood test may be done to check for thyroid problems or other conditions that may be associated with poor sleep. Keyword: sleep habits review. In addition to asking you sleep-related questions, your doctor may have you complete a questionnaire to determine your sleep-wake pattern and your level of daytime sleepiness. You may also be asked to keep a sleep diary for a couple of weeks. Sleep study. In the case of your insomnia isn't clear or you have signs of another sleep disorder, such as sleep apnea or restless leg syndrome, you may need to spend a night at a sleep center. Tests are done to monitor and record a variety of body activities while you sleep, including brain waves, heartbeat, eye movements, and body movements. Now, what is a treatment for insomnia? Well, changing your sleep habits and addressing any issues that may be associated with insomnia, such as stress, medical conditions, or medications, can restore restful sleep for many people. If these measures don't work, your doctor may recommend cognitive behavioral therapy, medications, or both to help improve relaxation and sleep. So let's go over what cognitive behavioral therapy for insomnia consists of. Cognitive behavioral therapy for insomnia, or CBT-I, can help you control or eliminate negative thoughts and actions that keep you awake, and is generally recommended as a first line of treatment for people with insomnia. Typically, CBT-I is equally or more effective than sleep medications. The cognitive part of CBT-I teaches you to recognize and change beliefs that affect your ability to sleep. It can help you control or eliminate negative thoughts and worries that keep you awake. It may also involve eliminating the cycle that can develop where you worry so much about going to sleep that you can't fall asleep. Excuse me. The behavioral part of CBT helps you develop good sleep habits and avoid behaviors that keep you from sleeping well. Some strategies will include, for like an example, stimulus control therapy, where this method will help remove factors that condition your mind to resist sleep. For an example, you might be coached to set a consistent bedtime and wake time and avoid naps. Use the bed only for sleep and marital sex. And leave the bedroom if you can't go to sleep within 20 minutes, only returning when you are sleepy. Relaxation techniques. Progressive muscle relaxation, biofeedback, and breathing exercises are ways to reduce anxiety at bedtime. Practicing these techniques can help you control your breathing, heart rate, muscle tension, and mood so that you can relax. Sleep restriction. This therapy decreases the time you spend in bed and avoids daytime naps, causing partial sleep deprivation, which makes you more tired the next night. Once your sleep has improved, your time in bed is gradually increased. Remaining passively awake, also called paradoxal intention. This therapy for learned insomnia is aimed at reducing the worry and anxiety about being able to get to sleep by getting in bed and trying to stay awake rather than expecting to fall asleep. Light therapy. If you fall asleep too early and then awaken too early, you can use light to push back your internal clock. You can go outside during times of the year when it's light outside in the evenings, or you can use a light box. Talk to your doctor about recommendations before you try any of these. These things are not meant for you to try on your own. So if you want to try the light therapy, please make sure you talk to your doctor first before you do it. Some other ways is prescription medications. Prescription sleeping pills can help you get to sleep, stay asleep, or both. Doctors generally don't recommend relying on prescription sleeping pills for more than a few weeks, but several medications are approved for long-term use. Some examples of these are keyword Lunesta, Rosarum, Sonata, Ambien, Edluar, Intermezzo, and Zolpidem. Prescription sleeping pills can have side effects such as causing daytime grogginess and increase the risk of falling, or they can be habit forming. So please talk to your doctor about these medications and any other possible side effects. If you're on any of these and you don't want to be on habit forming or addicting, talk to your doctor and let them know. What about over-the-counter sleep aids? Well, non-prescription sleep medications contain antihistamines that can make you drowsy, but they're not intended for regular use. Talk to your doctor before you take any of them, as antihistamines may cause side effects such as daytime sleepiness, dizziness, confusion, cognitive decline, and difficulty urinating, which may be worse in older adults. So what do you do for your lifestyle and home remedy changes? Well, no matter what your age, insomnia usually is treatable. That's the good thing. It is very treatable. The key often lies in excuse me. The key often lies in changes to your routine during the day and when you go to bed. These tips may help. Some basic tips that you can do at home. Stick to a sleep schedule. Keep your bedtime and wake time consistent from day to day, including the weekends. Stay active. Regular activity helps promote a good night's sleep, like exercise at least a few hours before bedtime and avoid stimulating activities before bedtime. Check your medications if you are on any. If you take medications regularly, check with your doctor to see if they may be contributing to your insomnia. Also check the labels of over-the-counter products to see if they contain caffeine or other stimulants such as pseudoephedrine. Avoid or limit your naps. Naps can make it harder to fall asleep at night. If you can't get by without one, try to limit a nap to no more than 30 minutes and don't nap after 3 p.m. So if you take a nap, try to make it if it's like an afternoon nap, anywhere between 12 to 2:30. Anything from 3 o'clock on after will affect your sleep. Avoid or limit caffeine and alcohol, and don't use nicotine. All of these can make it harder to sleep, and effects can last for several hours. Don't put up with the pain. If a painful condition bothers you, talk to your doctor about options for pain relievers that are effective enough to control pain while you're sleeping. What they're talking about in a case like this is, say you have a broken foot or a broken toe, and they have you on a medication. If when you take the medication you cannot sleep because the pain is so unbearable and the medication's not helping, please let your doctor know. Tell them, look, I can't sleep at night. This medication's just not doing the trick. And maybe they can give you something that will help you better. Avoid large meals and beverages before bed. A light snack is fine. It may help avoid heartburn. Drink less liquid before bedtime so you don't have to get up to urinate as often. Before we continue, let me let you know on one thing. I used to be a certified fitness instructor, and I took health and nutrition and passed with flying colors. The way we are supposed to eat is we are supposed to eat a big meal at breakfast time to give us energy throughout our workday, okay? And then 2 light meals in the between the afternoon and evening. So you have a big, like, full course breakfast, then a light lunch, and a light supper, where you can have like a light bedtime snack afterwards. And the reason for this is our body's metabolism at a certain time slows down and stops. So what you eat, like if you eat, most of us reverse it. We'll eat a small breakfast and a small lunch and a big dinner, which isn't really healthy, because when we do that, we're going to sleep with all this food in our stomach and our metabolism isn't burning it off. It's just sitting there because our metabolism is very low to nil in the evening time. That's why we're supposed to eat a big meal in the breakfast time and then 2 smaller meals throughout the day, and then before you go to bed, have a light snack if you're still a little hungry. So if that's one of your things, work on changing your food habits will help. You change your schedule. Even if you eat like a light breakfast, to eat a big lunch and then a light supper. But just make sure that either your breakfast or your lunch is big and not your dinner. Because if you make your dinner a large 3-course meal or more, you're going to have a problem burning that off. That's going to cause gas at night. Could give you stomach aches. It just doesn't burn, and your body's not using it the way it's supposed to. Food is meant for nutrition, but it's also used for energy. So 99% of what we eat, okay, we use that food for energy. And if our metabolism isn't burning it, it turns into fat instead of using it for what it's intended for our muscles and everything else. So that's why it's important not to eat a big meal at dinner time, to eat it either early in the afternoon for lunch or preferably a big breakfast. I just wanted to let you know that before we go on. Okay, so what can you do at bedtime to help fight insomnia? Well, at bedtime, the first thing you can do is make your bedroom comfortable for sleep. Only use your bedroom for marital sex or sleep. Keep it dark and quiet at a comfortable temperature. Hide all clocks in your bedroom, including your wristwatch and cell phone, so you don't worry about what time it is. And that's so true, because sometimes, like when I sleep, um, the first thing I do, like when I wake up to urinate or I think I had enough sleep, is I look at my time, my clock, which is like my phone. I'll look at the time and it's like, oh, good God. And I end up having to pull the sheets over my head so I can fall back to sleep. So if you don't have these over you, you get the proper amount of sleep. So that's one thing. Keep it dark. Hide all your clocks, whether it's a wristwatch, a cell phone, a tablet. Turn your computer off if it's in your room, because your computer will have a time. Anything that shows a time on it at nighttime, you want it hid. You don't want to be close to the time. Okay? Keyword: find ways to relax. Try to put your worries and planning aside when you get into bed. A warm bath or a massage before bedtime can help prepare you for sleep. Create a relaxing bedtime ritual, such as taking a hot bath, reading, soft music, breathing exercises, yoga, or prayer. For me, what I need to do to fall asleep, because I cannot fall asleep if it's completely quiet. I have soft music on. I normally listen to like meditation music or sleep music or just soft sounds like the woods or the water or something like that, and I fall asleep just like that to it. I do try to take a bath a couple of hours before I go to sleep, and that, of course, is because of my hair. I have to give my hair time to dry, and they do help to where I get a good night's sleep. Okay? Avoid trying too hard to sleep. The harder you try, the more awake you become. Read in another room until you become very drowsy. Then go to bed to sleep. Don't go to bed too early before you're sleepy. I find a lot of times myself, if I go to bed anywhere before like midnight for me, I won't get a full 8 hours sleep. I wake up in the middle of the night about 3 or 4 o'clock in the morning. It's too early for my body to sleep. Okay, so I will stay up until I start yawning. And I don't mean just one yawn. When I start yawning continually, like 5 or 6 times, I know my body's starting to get tired. And when I'll do that until my eyes get heavy. And what I normally do, like right now, what I do, I have an old TV show that I like watching, and I will binge watch it. And I will binge watch it until I start yawning and my eyes get heavy. When that happens, I turn off my show. I make sure my tablet's plugged in. I turn it off though. I make sure my phone is plugged in but turned off so I don't see no time on. And I play soft music on my CD player and I fall asleep. And then I normally wake up and I had a good night's sleep and I wake up about 8:30 and I feel fine. So that does work. Um, get get out of bed when you're not sleeping. You sleep as much as you need to feel refreshed, and then get yourself out of bed. Don't stay in bed if you're not sleeping. If the bedroom, that's what it's made for, is sleeping and marital sex, of course. So if you're not doing either one of them, try to stay out of the bedroom and get active. Go out for a walk if you don't work. Clean the house. Do some yard work. Activity will help burn the energy so you're tired. Have you ever noticed a child when they're not active during the day, they stay up all night? Well, that's because they're not burning activity. And that's one of the problems we have with a lot of people that have ADHD. Unfortunately, today's day, it's not like what it used to be when we were children. When we were children, we would go outside and play until it was time to come in. We'd watch up, eat our dinner, watch a few programs, and then our parents had a set bedtime for us because we had to get up early in the morning. Today, technology has taken that to where kids are either on the computer, sitting down, not burning energy, on their video game systems, playing video games all day, not burning energy. So their sleep patterns are all messed up. And that's what happens. And then when they're adults, if they're a gamer and they're on the game system all the time, or they're in their bedroom watching TV and they're not active, they can't sleep at night. So they'll stay up all night like an owl and they'll sleep during the day. The best thing to do is stay as active as possible. Get up, take your morning shower to help you wake up, have your tea, coffee, hot cocoa, a good breakfast, and then get on with your day. If you don't work, get out, do some yard work if it's not snowing. If it's snowing and you don't work, make it a big cleanup day. Do something in your house. Make yourself some projects. If it's warm enough to take a walk, take a walk. But keep active. The more you keep active throughout the day, the more energy you burn. Okay? And that's what keeps us awake. Like I said, our food supplies our energy. So if we're not active, everything we eat is sitting inside of us. And then at nighttime, our metabolism slows down to almost nothing. Then it doesn't burn it right, and then it turns into fat. So if we keep active by going on walks, doing workouts, go to the gym. If you can get a free gym workout, go to a gym. Learn some exercises you can do at home that you don't need a gym if you can't afford a gym membership. There's a lot of exercises you can do at home to keep you active. Work in the backyard. If you have to shovel, go out shoveling. That's a lot of exercises. That builds up muscles in your arms. But it also burns energy. So then at nighttime, you're tired. That's why, like when you work, if you're at a job that's active, when you come home at night, you want to crash because you burnt all that energy up. Okay? So that's important. Okay, what about alternative medicine though? Well, many people may never visit their doctor for insomnia, and they try to cope with sleeplessness on their own. Although in many cases, safety and effectiveness have not been proved. Some people try therapies such as melatonin, Balarin, acupuncture, yoga, or Tai Chi, and meditation, and a lot of these do help. Now, I want to give a caution about anybody that does suffer from insomnia that want to try herbal or dietary sleep aids. because the Food and Drug Administration does not mandate that manufacturers show proof of effectiveness or safety before marketing dietary supplemental sleep aids. Talk with your doctor before you take any herbal supplements or any over the counter products. Some products can be more harmful than good and can cause harm if you're taking other certain medications. So that's important to know. So I gave you a lot of information about getting a diagnosis for insomnia, what's involved in it, and some things you can do to help treat it. Always check with your doctor for everything. If you haven't seen a doctor for your insomnia, it doesn't hurt to make a doctor's visit. It's more helpful because, as I just said, not everything over the counter or any other type of sleep things always works. Sometimes you need the help of a specialized doctor that can help you battle your insomnia so you can have a good night's sleep. And that concludes this segment on insomnia. Um, I hope you enjoyed it and that you learned a lot. Please let me know what you think of this video in the comment sections. And as I said, don't forget the 3 keywords that I mentioned in the video. And remember to always see with your heart and not with your eyes. Stay tuned, a lot of different things coming up on my channel. And we'll talk to you later. Bye. Love you all.